Hey, welcome back, everybody. It's time again to talk about Tomii Healing and Wellness. The one show, the only show that shows you an alternative path to healing and wellness in your life, exploring and using traditional Asian medicine practices and others as well here. So we're going to explore some of that today, as we always do. And today we're privileged to have with us not just another patient sharing their journey or their story, but to have with us another professional who has worked in some of the same fields as our esteemed host here, Dr. Chen. And we're joined with, on the left of your screen there, Dr. Karim. Why did I say Karim? Dr. Karim Abdullah. And it says ND and a whole bunch of other things after your name. You're a naturopathic doctor, right?
Yes, sir.
Let's start by explaining what is a naturopath.
Okay, so in naturopathic medicine, first to be fair, over 100 years ago in the 1800s and 1700s, medical doctors, it was not a big issue when they used natural herbs or plants to treat patients.
Traditional healing methods, and maybe they learned from their grandmother or something.
Exactly, and even if they went to medical school. In fact, when I went to Bastyr University in Seattle, that's the Naturopathic Medical School. They have a campus in San Diego, and their main campus is in Seattle. At University of Washington Medical School, across the street, they had the largest medicinal herb garden in the United States. Oh, yes.
Okay.
Yes. I don't know if that's the case anymore, but back in the 40 years ago, that it was the largest in the United States.
Right.
And for our homework, for our studies, we had our own medicinal herb garden, but we had to go to University of Washington Medical School
And borrow theirs.
and look at theirs, where their medical students, I don't know if they studied the herbs that we were studying.
Yeah.
So, and it was an extensive medicinal herb garden. In fact, the word drug is the French word, drogue. It means plant.
Really? Now there's something I never knew before.
Yes,
Okay.
yes. So
Because, and to
Yes.
your point, all the great pharmaceutical companies that we all know of, so many of which are around here at the University of California, Irvine's campus here, the Biogen, Allergan, and all these things, they, for the most part, don't whip these things up wholesale out of nothing. They often find some plant, and then they try and copy it or improve upon it, and therefore they can patent it.
that's correct. Like red yeast rice extract comes from red yeast rice, which I was in the Asian market yesterday, and there goes the red yeast.
Yeah.
But if you can make it into a medication and patent it,
Proprietary formula or
correct,
something.
and
right?
you can put a trademark on it, well, you got a new pharmaceutical that is a statin drug now.
Right. Somebody told me years ago, I remember, I don't travel that often. This is a strange story. I'll try and make it quick. I'm down in Central America, and I met a guy who's down there from some university, and they're researching, they're going out into the wilderness trying to find these plants and find the, whatever you call them, shamans, traditional medicine men, whatever people have been prescribed, because these are, you go back thousands of years. And you got this problem, we use this bark, we use this root, we use this herb or something here. And they're trying to see if there was anything to any of these so that they could find new drugs. And I said, but isn't that kind of crazy? I mean, he said, well, not as crazy as you think. They've had the best clinical trial for 1,000 years. If it didn't work, they didn't do it. If somebody died, they quit prescribing that or giving that to people. They've had a trial and generational trials using these herbs and plants. Why shouldn't we add some validity to that and look into it and see if there really is something there? And then, yes, we want to pull out something proprietary, maybe improve it, maybe change it, and certainly patent it. But they're going out to the jungles to try and find what people are doing.
And that's part of the history of the United States, part of the history of medicine in the United States. When the settlers came to the United States, when they were sick and they had disease, they went to the Native American medicine people,
Right.
men and women, who taught them this tobacco does this, and it's not just used for smoke, we use it for this, and sage is used to help clear worms or to fumigate your home. The Native Americans have different tribes have all different extensive understanding. So the pioneer medical doctors in the 1800s, 1700s, 1800s, they knew a lot of herbs, particularly if they were close to the people, the Native Americans and the settlers.
Right.
And they took pride in being able to help people with what they learned from Native Americans. However, as chemistry started developing throughout Europe and throughout the New World, chemistry, and I get it as a scientist, as a doctor, is exciting because so many things you learn and so many advances with synthesis and
not just what that plant does, but why.
Exactly. And you can break it down and you study the periodic table and, Western science, I give it credit. It's very objective. They want to see double-blind peer-reviewed studies. However, in certain times, there was some concept that developing medicine in the laboratory is the way of the future. And I get how we humans could think
certainly
that.
Became that.
It did.
And we threw all the traditional herbs and remedies and the whole,
as folk medicine.
Folk medicine.
Correct.
Yeah.
So
witchcraft.
Exactly. So there was a tug of war going on, and there was a natural hygiene movement in the United States where Kellogg and Kellogg cereal and graham cracker, going back to nature, they were trying to push against what they call the doctors who were chemists. When I was a boy in New York City, not all drugstores said drugstores. Some said chemist.
Yeah.
You remember that? Okay.
I remember that.
It was chemist.
England too, particularly.
Exactly. We
Right.
knew as kids, oh, that's a drugstore because it said chemist.
Right.
However, there were diseases in the early 1900s. I'm going to stick to that early America, that some of the doctors would use mercury, which the common name was quicksilver.
Yes.
So they would say, oh, patient has syphilis, give them quicksilver. And so
Can you imagine prescribing mercury to
exactly,
how poisonous that is?
Totally right. There's others. But that tug of war, that fight between those who felt chemistry was the way for treating and healing human beings is much better than this herbal.
They thought
folk medicine.
radium for a long time too.
Exactly.
After Marie Curie invented radium, they thought it'd have a curative effect or something.
I was mentioning that to a patient about an hour or two ago. So radium was exciting.
Radium, we're going to get
Chemistry,
radioactive material. This is going to help
Mercury
you.
was a metal that could run. So they would give mercury to treat syphilis, and people would get worse or sick.
Yeah.
It would kill the syphilis, but also kill the patient.
Yes, exactly.
So the doctors using natural medicine would say, oh, don't go to those guys.
Yeah.
They're the quicksilver doctors.
Yeah.
That it's switched into the short jargon. They were the quacks.
Yeah.
Nowadays, we're called the quacks.
Yes, exactly. Isn't that interesting?
Yeah.
The quicksilver.
The quicksilver,
they were
because
the quacks.
they would rather pick up liquid mercury or quicksilver. These are the quacks. These are not.
Yeah.
Yeah. So there was a big fight that in Washington State, naturopaths were called drugless healers about 70, 80 years ago. We were called drugless healers because those using drugs, those were the quicksilver docs.
Right.
And we who preferred to use natural medicine, we were called naturopaths.
Plant-based medicine.
Naturopathic doctors.
So I just want to cut you off.
Yes, go
All
ahead.
right. So this bifurcation happened where doctors couldn't, you had to pick your side of the fence here. You're going to use traditional herbs and remedies and things that have been used for centuries.
Yes.
Or are you going to switch to all chemicals and synthetically produced stuff here? And along the way, we came up with different sets of MDs, doctors. As a naturopath, is it registered as an MD in this state and other states? And before you answer that, for a long time, osteopaths,
Yes.
that's a whole other idea,
That's correct.
were not treated as real doctors. It wouldn't be allowed into hospitals and that has changed.
Yes.
And my late mother used to go to an osteopath, and he had full visiting or whatever privileges at the hospital and all that kind of stuff. And she was amazed because when she was younger, an osteopath was not someone. Chiropractors are still, I don't know where they fall in the spectrum here, but outside the traditional MD degree, when you get a naturopathic MD degree, is that recognized as a doctor, or can you go into hospitals and do other things, or are you still treated as something other than a doctor?
Good, excellent question. It's each state is different For example, in Washington State, a naturopathic doctor is considered primary care physician.
Okay.
On our license at the Department of Health, we're called naturopathic physicians.
Okay.
In California State, we can't call ourselves physicians. We have to be naturopathic doctors, but we are licensed in the state of California as primary care providers.
Okay.
Just like acupuncturists in California are considered primary care providers, but in Washington State, acupuncturists are not.
So they've earned different levels of acceptance and respect and certification depending on the state that you're in.
Yes, a naturopathic doctor has to go through 4 years of medical school.
The same medical school that everybody goes to?
Absolutely.
Okay.
You have to study the first year anatomy, physiology, biochemistry, organic. You have to study pathology, OBGYN, pulmonology, hematology.
The whole thing.
Pathology. Yes, you have to know. Yeah. And you're given, after your first 2 years, you're given a national board exam of 5 basic sciences.
Mm-hmm.
If you pass that, you can go further in your training as a naturopathic doctor. And that means that after you finish your 3rd and 4th year of medical school, you cannot get licensed until you pass 10 more exams in clinical medicine.
What?
Oh,
Wow.
yes, yes. Plus, you have to study.
So it's in addition to, not in place of. I guess my perception was you're studying some different curricula, they're studying something different, and you both come up with a different view of the world. You're saying, no, you both have the same foundation, the same medical training.
Correct.
And then you have an additional training on top of that for these, what would we call them, plant-based,
Yes.
natural remedies?
That's correct. You're studying side by side with your pathology, and your pathology textbook, your anatomy textbook, your OBGYN textbook is exactly like you'd see at UC Irvine Medical School,
Right.
or at UCLA or wherever.
Right.
We study the same exact, but we're taking, typically at Bastyr, you're taking 11 different courses per semester, per quarter.
Wow.
Yeah. It's heavy duty.
It's usually like half of that.
Yeah, it's a lot. And you're studying nutrition, how to treat.
Oh, nutrition,
You
come
have
on.
to, yeah.
Doctors get what? One course, and traditional MDs get one. They always talk about it. What do we know about nutrition?
Yes, you study the basic of nutrition, and then you study the therapeutics of nutrition, how to treat diabetes with nutrition, how to treat cancer with nutrition, how to treat depression with nutrition,
Wow.
how to treat bipolar disorder with nutrition.
And many people think you are what you eat.
Correct. This is what I was mentioning when I spoke. I was invited in Seattle to speak to a group of medical doctors, and when they heard I was a naturopathic doctor or a naturopathic physician, you can see the smirks and the,
okay,
the
one
elbow.
of those, yeah.
Exactly. So I said, okay, let me put it this way.
He's going to bring out his magic elixir and his somebody's medicine show here, yeah.
So I said to them, imagine if I say, hey, everybody, after this talk that I give, I have a new restaurant, it's a buffet, all you can eat, no charge. There's roast beef, there's lobster, there's chicken, there's prime rib, steak, you name it. You just have at it. And
Right.
I'm not charging you anything. Oh, by the way, everything that's at the buffet, we created in the laboratory.
It's fake beef.
Everything's synthetic.
Yeah.
Then they got the
Which is
message.
starting to be reality out
Exactly.
there,
I
yeah.
said, which would you prefer, the roast beef that's a synthetic model of roast beef,
Yeah.
or would you like the natural thing? They said the natural thing. I said, that's the why are we fighting with each other?
That's a great story. All right, so now you took this path and became a naturopath. And are there lots of naturopaths?
Yes.
I see some here and there.
Yes.
And I don't know. I don't know where they are, why they are, and I don't know how to
Yes.
find them. But there are more and more, I suspect,
Yes.
in Southern California.
Yes,
Because we're into alternatives. We're into trying something different. I'm not sure I
Correct.
trust traditional medicine anymore. I'll give you a story that says it all. My wife has high blood pressure.
yes,
Goes to the doctor.
Mm-hmm.
This is scary. You're in stroke territory. You got to take this pill.
Mm-hmm.
Well, I want to get rid of the problem. Well, I don't know how to get rid of the problem, but take this pill and it'll bring it down. It'll counteract it. It'll cover it up.
Mm-hmm.
And she doesn't take the pill. And I say, why? She said, I don't like pills. I don't trust pills. I'm worried what's in the pill. What are the things in the pill? What side effects of the pill? And I said, don't worry about it. It's a pill. It's approved. It must be good for you. And it does bring your high blood. So sometimes she does, and it does bring it down, and then sometimes she doesn't. We all have. And I say, you're not a doctor. What do you know? She says, I know my body. And I don't know that I want to put fake stuff in there all the time. I don't feel good about that. And therefore she doesn't. She'd like to go to Mother's and get natural herbs and other sorts of things. And her first impulse is to try something other than a pill. Are she alone? Or are there more and more of those people?
Well, there's many naturopaths.
And are we crazy for feeling that way?
No, I won't say they're crazy, because like we were bringing out the example of the restaurant, if it's all synthetic, we know everyone that eats at that restaurant, they're going to get sick eventually from the synthetic food, because the body's not synthetic, it's natural.
Right.
So the doctor...
In addition to not just the process of synthetically making something, we always discover after the fact, oh, there's some additive, there's this and that and other things in here that are carcinogens or other sorts of
And what do we call it? Junk food, almost.
Yeah.
We call it... Okay, so the World Health Organization, for the past 10 to 20 years, they've done meta-analysis, and they find better outcomes in treating hypertension, cancer, COVID, opioid addiction, utilizing an integrative medical approach.
Yeah.
And so they put
Integrating meaning combining
natural
traditional
medicine with conventional medicine.
Yeah.
And they said, because they're the governing body internationally of all medical communities in United States, Europe, Asia, they're the governing body of the standards.
And I never heard that term until recently, but here we are at UCI, the University of California Irvine
Correct.
campus, and right around the corner from this building is the Susan Samueli, the wife of the guy, one of the founders of Broadcom, chip makers,
Exactly.
these billionaires, and she has invested a bunch of money into creating, I got to believe, one of the first integrative medicine centers around, one of the few I know of here on campus, where they're trying to teach doctors and nurses and all this stuff. Her idea is that there is some value, and I think she believes in
Homeopathy.
and I know she's also into acupuncture and some other things. So they have some clinics now, and they're trying to explore taking traditional doctors and adding to their knowledge base with other, what I'll call, traditional practices.
When I went to medical symposiums in San Diego, there was a consultant for the World Health Organization. She came there 3 different years, and she said, those of you that are medical doctors, you're going to have to get used to the new where medicine's going. It's going toward integrative medicine.
Yeah.
This old way of conventional medicine going to monopolize,
Specialized, single
she
focus.
said that's
yeah.
it's not going to be that way. It's going to be, we're encouraging integrative approach. So, and she said, those of you that are medical doctors have to learn more about natural medicine, and those of you that are in natural medicine have to learn more about biomedicine, which is allopathic or conventional medicine. Because she said, we want you working together in hospitals, nursing homes, research centers, and outpatient clinics.
Not against each other. Dr.
Right.
Chen, I'm going to let you speak. I know you always struggle speaking English here, so I try not to ask you too many questions. But who was the guy, the doctor that you met at a symposium up at UCLA and have since gotten to know pretty well, who runs some sort of integrative medicine practice, or it is integrative medicine clinic at UCLA, Dr. Kiki
Dr. K.K. Hui.
Kiki Wee, yes.
Kiki Wee,
And
yeah.
he's actually on staff and teaches medicine at the medicine school, and also has this integrative center where he's exploring and teaching, and I call it Chinese medicine, but I guess they're calling it better now Asian medicine, because it's not just from China, it's all these things, which is a more of a traditional practice we would think of as herbs and acupuncture, and what you do, Dr. Chen, acupressure. Talk about that. He was fascinated. He came down and took a look at what you were doing here when you met Dr. Kiki Wee. Talk about that for a little bit here. What did he say? What did he think? What do you think about that?
Yeah, Dr. Kiki Hui is a MD. Then he started
Exploring all those other
the
things.
traditional Chinese medicine. Yeah, he's the founder of the UCLA, the Integrated Western Eastern Medicine Center.
Yes.
So here's a guy on staff who's trained in traditional MD and beyond, and is now exploring all these different practices. So let's talk about some of the different practices around the world. Asian medicine, what I thought of as traditionally Chinese medicine, or variations of it in Vietnam or Japan or whatever. They're all kind of the same idea that there is somehow an energy within your body that can, if it's unblocked, do amazing things. Is that, if I'm overstating the basis of all these Asian medicines, that there's meridians transferring this energy around your body here?
If you look at the World Health Organization website on integrative medicine, they also include Ayurveda, which is the traditional medicine from India.
Right.
They include Siddha medicine, Siddha, which is from southern India.
Okay.
And it's over 1,000 years old and very sophisticated too. They include Tibetan medicine, which is very sophisticated and is very active in the world today. And they include, of course, traditional Chinese medicine. They
sometimes listed as TCM, traditional Chinese medicine.
They have a medicine that the world has hardly heard of, which, by the grace of God, I want to share with the world to my capacity, called Unani medicine. Unani medicine is Greco-Arabic medicine.
Never heard of that one.
Yes, because during the Middle Ages, during the time over 1,000 years ago, when the Crusades and the Renaissance, that was a time where the Christendom was fighting against the world of Islam.
Right.
And they found that they were told in Europe that these are heathens and they're against us.
Right.
And
even though in many ways scientifically they were way ahead of
they didn't know that then.
No, right.
But when they actually went to the Muslim lands, like Jerusalem and Spain, they were shocked because the Muslims had surgery, they had ophthalmology, text in ophthalmology, they had text in internal medicine, they had anatomy books to the detail. Many of the surgical instruments today that we use were developed by Arabic physicians.
And the so-called Western doctors were still using leeches and trying to...
Exactly, and many of the language, the word chemistry comes from an Arab scholar called Al-Khamiyya.
I didn't know that.
Algebra, the mathematical...
Algebra I knew, yeah.
Abdul-Jabbar.
Yeah.
Helped develop because...
The famous basketball player? No.
No, so the Muslims were very sophisticated in medicine and science. And how did Columbus come to the New World? He used Muslim Arab navigators, because the Arabs were good in navigating in the desert. They were good in navigating in the ocean to the New World. So the medicine, a lot of the distillation techniques that we learn in organic chemistry came from Arabs.
Wow.
And they have if you look in Encyclopedia Britannica or look online, Ibn Sina, Kanun Fitib, the canon of medicine, which is... And
yet most of these texts were burned or banned or
in the British
aside.
Museum or things like that. So there's a whole system of medicine that's contributed, among the medicines that contributed the most to Western medicine as we know it today, including drug medication, is the Muslims and Arabs in the Middle East.
Never knew that. Okay, all right. So lots of traditional practices. It wasn't until they had to do something. People were getting sick, so people started experimenting with herbs and whatnot. Maybe it was the little old lady, the midwife, who passed it down or knew this knowledge, or maybe it was the local shaman or whatever you call them here. Somebody took this role and tried to learn what they could about leaves and plants and bark and whatever else, and how to use this to combat diseases and stuff. And sometimes crudely, sometimes wrongly, but over centuries, they figured out they found some things that really worked here.
But the thing is, in the Muslim community or Islamic civilization, Prophet Muhammad, may peace be upon him, forbade the Muslims from using magic or shamanistic techniques not based on science.
Wave a magic wand.
If you read the Quran from cover to cover, it's very scientific. The Quran, the holy book of the Muslim of the Muslim faith, it's very scientific, and it says, "Wala tatkaw fil mizan." Don't forget the balance. The creator of this universe says, yes, he created yin and yang. That's yin and yang.
Yeah.
The Chinese saying, and so Muslims and Prophet Muhammad, peace be upon him, said, studies. The first thing revealed to humanity from the Quran was Iqra bismi rabbika alladhi khalaq. Read in the name of your Lord, who created the human being from a clot in the womb, basically.
Yeah.
And the word Iqra means read, meaning that he created the human being to be enlightened. The creator could have said, I want you to pray, I want you to give charity, I want you to help the poor. No, the first thing that the creator revealed in the Quran to Prophet Muhammad was to read, because he said he intended the human being to be Khalifa in the earth. Khalifa is feminine. Khalifa, masculine.
Mother Earth.
Yes, Khalifa means you're a custodian.
Right.
And Imam is who leads prayer, but Khalifa is behind, as the custodian. When we look at this building, we see the custodian, we say, oh, hi.
Yeah.
And we just ignore them. But in the background, they're keeping the lights on. They're keeping the heat on and everything and so on and so forth.
And I'm sorry to say that because of our tribal nature as people and because of the wars and the fights and the disagreements and the religious aspects and all this stuff to it, we've become isolated in our knowledge base. There is Western medicine. There is Eastern medicine. And there is Middle Eastern medicine, apparently, too.
Yes.
And there is no conversation, much less acceptance or even interest in what they've been doing. Here's what we do. And I always say the way I approach it is Western medicine's great if you break your leg or you need a heart transplant. They've got machinery and techniques that are unbelievable, that have extended human life. But if you got a headache, you got a backache, you got a persistent pain, you got a chronic condition, they don't know what to do. I got pills and I got a procedure. I can operate, or I can give you a pill to cover it up. That's kind of the extent of my bag of tricks here. And traditional healers for a long time viewed it as, if you get sick, you were talking about this, then we failed. If we didn't catch this early enough, if you ate a bad diet, if you didn't diagnose these things before they developed into cancer or blood clots or other horrible things, that Western medicine is going to go in and intervene, we have failed. Western medicine waits till it manifests itself and then tries to go in and either give you a way to deal with it, handle it, cover it up, whatever it is, an opioid to get rid of the pain, not to get rid of the underlying pain, but to help you deal with it, or we're going to cut it out. That seems to be the exact opposite of what all these traditional practices. Am I overstating that?
In a way, yes, because to be fair to our medical doctor colleagues, and I was going to be a medical doctor,
right,
but my mom developed cancer and she had chemotherapy and radiation, and her skin turned gray, and you know what chemotherapy and radiation could do.
Horrible.
The intent...
Because somebody said you're using a sledgehammer to try and get a sliver. There is one problem, and you're battering the body.
Well, to be fair to my medical doctor colleagues and my friends, because I've worked for 18 years with medical doctors, mostly medical doctors. I've worked at the largest integrative medical center in Seattle, Seattle Healing Arts Center, founded by Dr. Fernando Vega. And he's a professor, a full professor at University of Washington Medical School.
Okay.
And so we enjoyed working together, because those doctors who are clinicians and we're not academics, that's a big difference.
Okay.
Clinicians like Dr. Chen, myself, we love people.
Hands-on patients.
Hands-on, and we want whatever works.
Right.
Sometimes I have a patient with hypertension, 240 over 110. There's no way I'm going to give them a herb, because I know herbs that can lower it,
right,
but I know the drugs work better. So
right,
in Washington State, I can prescribe lisinopril, losartan, hydrochlorothiazide, you name it, I can
right,
prescribe it, because I'm very pragmatic. I want my patient to live. And if I get hit by a car, I want to see a medical doctor. I don't want to see a naturopath or osteopath or acupuncturist.
No, right.
Everyone has their own gifts, and we need everybody.
Yes, which is the idea of integrative.
That's right. We can be friends. We don't have to be enemies,
right,
and we certainly don't have to be arrogant.
Right.
The worst disease that a doctor can have is arrogance and ignorance.
Well, I'm a little biased against the medical profession. I saw my parents suffer and die into old age. Yes, they lived to be in the 90s, but at the end, the medical system failed all of them, not because they died, but because they started treating them just like, I don't know, you're too old, I'm not going to bother with you, I don't care about you, you're old, what do you expect? They wanted to deal with other younger patients they could help and cure and whatever. As they got older, I almost felt like they didn't even want to see them anymore. And at some point they did say, stop coming.
Well, I'd like to use quotes from the Quran. God, the creator of this universe, the creator, whatever name you wish to call,
right,
says, I made you different. He could have made us all one, let's say in medicine, all the same.
Right.
But he makes us different, not that we fight each other, but we learn from each other.
Boy,
so we have a patient with hypertension. We have a patient that's suicidal. We have a patient that is has autoimmune disorders. We have a patient that has long COVID.
And maybe
we can
multiple
collaborate.
Things.
Yes, correct. Because
it's a holistic approach.
Exactly. Because, and I love the way we're licensed in Washington State and perhaps here in California, because if my patient has a disorder, let's say he has headaches, as we were talking earlier, there's 28 or more different types of headaches.
Yeah, I didn't know that.
Oh yeah. So MRI, CT scan, X-rays, all of that are still useful. We shouldn't throw away the baby with the bathwater kind of thing.
The baby with the herb.
Right. Though conventional medicine is the youngest medicine amongst us, it's the predominant. But that doesn't mean they can't learn anything from us and we can't learn anything from them. And guess what? We become better physicians, better doctors if we learn from each other.
Extend your range of options, not just
exactly, because what do we go to medical school for? To help people.
Supposedly.
Yeah. So, but if we get the people who are money hungry or power hungry or ego hungry, that want a big name, want to make the big bucks, for
Big
us as
chain of
clinicians,
clinics, right.
yeah, you can tell a healer from those who are interested in ego. And for us as clinicians, we're not into that. We don't care if you have MD beside your name, DO beside your name, ND beside your name. Can you help my parent?
And you just rattle off doctor, osteopath, and natural.
Yeah, naturopathic doctor. Yeah. And
all right. So
Ayurvedic doctors too. They have a lot to contribute. Tibetan doctors have a lot to contribute.
We've gone around the world rather quickly here, and the whole purpose of having you on this show today was to talk about how you stumbled onto Dr. Chen. In addition to your naturopathic practice, you took it upon yourself to get a master's in acupuncture and what do we call it? Asian medicine?
Correct.
So what attracted you to, why didn't you just stick to herbs and natural remedies?
Because I will go see medical doctors because I don't see them as enemies. I see them as friends, and they can help me, and they do help me, and they have helped me, and they are helping me. I've had back pain and everything.
Yeah.
And
the little stuff the doctors go, I don't know.
I'm telling you honestly how it happened. And I have a nephew in Los Angeles. He's in physical therapy, and he's interested in acupuncture school, maybe, or physical therapy or sports medicine. I don't know.
Right.
But I want to help him any way I can.
Sports medicine. That's the money one right there.
Well, you know, whatever you're inclined to. So I was looking for places he can learn, and also for myself, because if I got sick, I said, who could I go to? Because sometimes we doctors are the worst patients, and
often,
yeah, because you know, when people get sick, we run toward them, and we don't think we'll ever get sick. But COVID really shook us up, and some of our colleagues died.
I think it really did.
Yeah, that humbled us because, like before COVID, we rarely went to doctors because we hardly got sick.
We're impregnable.
People cough in our face and everything, and by the mercy of God, we didn't
built
get sick.
an immunity to everything.
Yeah, so we don't go to doctors. But now that I'm getting older, I said, let me look for a good doctor here. So, like I did tell him, I looked at Dr. Chen's picture. I said, this is a healer.
Wow.
Yeah, because you can tell.
By the eyes or
the
demeanor?
If you're in clinical medicine versus academic medicine or administrative medicine, those of us that's on the ground floor or on the front lines, we can tell who's battle trained.
Yeah.
We can tell who has a kind heart and a very good intellect to help people and who cares about people.
That was kind of my feeling when I met Dr. Chen. You know, full disclosure, he's treated me and for what other little chronic things that nobody else could figure out, and it's helped.
Yeah.
And I don't totally know if I understand or believe all the underlying meridians and energy and all the other stuff, but by God, it works.
Yeah.
And I keep going back over and over again. And he definitely seems like a sincere, honest guy who's there in this funky little clinic up in the middle of a strip center in Anaheim Hills. This isn't downtown Beverly Hills with marble floors or something here. He's just there out in the field trying to help people. And I look at the range of people and they all look like me. They're not just people who are already comfortable, the Chinese or whatever, with this school of medicine. It's anybody and everybody from truck drivers to airline pilots to everybody in between, coming in with a chronic condition. Nobody else can give them any cure or help. Maybe there's no cure, but they can't give them any optimism, any way to deal with this, cope with this, other than a pill or procedure. And they come, and so many of them tell me over and over again, it's helping. It's helping.
That's how I learned, because at Seattle Healing Arts, you couldn't tell the doctors from the patients. We all look like everybody else.
Yeah.
Maybe we had a stethoscope at most. We had regular shoes on, this is the first time I wore a tie in years.
You both had ties on. I'm impressed.
Exactly. Because we're about helping people to heal. We're not into looking cool. However, the minute patients come to us and they listen, they can tell by our interview technique and process, this person knows what they're talking about.
And this
that
person
they can help me.
cares.
Yes, exactly.
There's a sympathy, there's
And
a feeling.
And like one, I was heard earlier kindly from the front desk. They say good doctors have kind eyes.
Yeah, that's what I've heard. Right? So I asked
And
about that.
and these are I thank you, front desk at the clinic I'm at. I'm very honored to work with you all. But this morning, the ladies at the front desk said, we can tell good doctors, they all have kind eyes.
Yeah. All right, so you were looking for somebody, was it your nephew, your cousin, something? I forgot.
For myself and for my nephew, and
Right.
I have a son who's deaf and autistic, and yeah,
There,
so
there are
yeah, so-
theoretically incurable problems here that
Mm-hmm.
that need help and direction. All right, so you stumbled upon him and found what? You came as just a patient, right?
yeah, and with his first treatment, it reduced my back pain and muscle pain. Yeah.
The secret behind the Tomii Healing System
Mm-hmm.
is the meridian energy pathway
Yes.
connection with the hand, leg, with your internal organ,
Yes.
liver, kidney, spleen. So anything happen inside your organ, your internal zang and fu, will show the blockage and the imbalance on your hand and leg.
Absolutely.
So
It manifests itself there.
we
and you can
have
measure.
the disruptive innovation system to map out where's the blockage, where's the imbalance. Then we use the acupressure, cupping, guasha, or the combination to help you to relieve the blockage.
Yes.
Then help the balance the internal organ.
And have you ever seen anything like that before, doctor?
This is what I was thinking when Dr. Chen was saying that. I've been around doctors of Asian medicine for over 25 years. And we take pulse, we look at tongue, we do the traditional ways of diagnosis. He gets to the point within 10 minutes as far as the diagnosis, where the imbalances are.
Right.
And he knows exactly where to put pressure on, what is sore. I mean, I don't know how he does it.
It blows
I
me
do
away.
think, and I want to say this to your credit, I think you're blessed. I think you're made to do this. I think you're a genius in it. Seriously, I think he knows exactly where to go, how to do it, how much pressure, and when to back off to let your body heal.
Here's my experience. This is just anecdotal, but he
Yeah,
told
I
me he had
think-
some problems and
Yeah, I think you didn't learn this in acupuncture school. What we
a
learned,
gift.
yeah, what we learned. I thank God for my teachers and professors from China. Most of my teachers from China, some from Japan, and they all taught from Chengdu and Xi'an and Beijing. Were my professors. But I don't know how you learn what you do, how you do it, but you do it better in a lot of ways than the classical
Wow.
traditional way. And I'm speaking almost Jin Feng. Jin Feng is the traditional way of,
Yeah.
yes, but they have a modern way in China, which we don't want as much because they simplify it a little too much, where the sophistication that's in the Huangdi Neijing, Shanhanlong, Jingui Yao Lu, and all of those classical texts, they were geniuses. Somehow you captured understanding of it to apply it in a very rapid diagnosis and very rapid therapy.
I would say because of his,
Yeah.
the only way I can explain it to people when they ask me about Dr. Chen is
Yeah.
he started life as a scientist in
Yeah.
sensor technology.
Yeah.
And it was only when he himself got sick and diabetes and other things that
Yeah.
it was so bad
I
he
read
had
about that, yeah.
read about this. So he took a scientific approach to what I'll call a traditional healing method and applied he again, integrative approach, trying to bring science into what had not been seen as, well, why do we need science? We need to measure this way. We've done it forever. We've got techniques to do this. They in the traditional schools didn't see any benefit to going out and doing clinical trials and trying to find scientific approaches and measurement tools. He brought some science into traditional, and we're always talking about trying to bring traditional healing techniques into the scientific medical community. He almost went backwards and brought some science to a traditional healing approach. That's the way I see it.
That's why I would love if he can be a forerunner to cross the bridge for
Yes.
integrative medicine.
Absolutely.
Not only in Southern California, but throughout the United States and the Western world, because Certainly, I've seen others that have sensors that pick up, but it's not. It's removed from knowing how to treat.
Yeah.
So your Tomii method that you've developed, it can be digestible, I think, for a Western doctor, more so than if I explained it.
Yes.
Traditional Asian medicine, because we were joking the other day. In Asian medicine, we'll say, oh, the reason why it has diabetes is a damp spleen. And that doesn't make sense to a Western doctor. Oh, reason why it has asthma is kidney yang deficient, failing to grasp the lung qi. That doesn't make sense to a Western doctor. But what Dr. Chen has developed, he's a translator. He's bilingual. And it's a certain way I'm bilingual too.
Very much so.
Yeah. And
science and tradition.
Exactly. Right. And I think, thank God that I was trained at Harvard Medical Center, cellular molecular biology and pharmacology, because it gives you a discipline and an approach to the Western science.
Yes.
Having Western science, I think, is essential for any doctor, whether they're in alternative medicine or conventional medicine. And to be fair, conventional scientists and medical doctors, I think it would be good if they can sit still and understand Asian medicine,
yes,
Tibetan medicine, Unani medicine, Ayurvedic medicine, because it will open, just like if you're multilingual, you have more friends you can talk to.
Yeah. And you understand there are more than one way to see a problem. Why, I bring up one, we're way over time, but we're going to play this out because this is a very, very powerful conversation here. And so often when I've talked to people who have been treated by Dr. Chen, when I try to explain to friends of mine and say, oh, that's just voodoo, that's witchcraft, come on, that's not fact-based medicine here, science-based medicine. You have faith in this healer, you have trust in this healer, you can't prove it, you can't see the meridians, you can't see the energy, all this kind of stuff that Western science immediately approaches all this with. And I say two things. Well, maybe not yet. We don't really fully understand this. We certainly accept acupuncture more than we ever did in the past. It's now accepted and paid for by Medi-Cal and Medicaid and other things here. And at hospitals, it's a pain relief accepted alternative. However, here's my point. Rather than always saying Western medicine, you got to open up your eyes. You got to take a look at other things. I also see the same sort of silo blinders on with traditional healers who for thousands of years said, this works. I'm not going to try and get to the heart of where the meridians are and how the energy flows. I'm not going to find a way to measure it. I don't need to. I believe it's there. I have it mapped out by somebody. I'm going to follow this without needing to prove scientifically where it is and how it flows, to understand the mechanism of it, which is what science does. And that seems to be somewhat what Dr. Chen's opened up, trying to understand the mechanism of this heretofore unmappable, unmeasurable, probably a better word, force in your body here. Just as we have a lot of people come out and talk about cannabinoids these days. And right here on campus, there's a cannabinoid research center here, and the whole cannabinoid system in the body was only recently kind of revealed or understood to Western medicine and how your body reacts to these cannabinoid compounds and stuff here. So was there a blindness in the traditional healers as well, who refused to see any value or importance or interest in trying to scientifically explore what they already believed?
I wouldn't put it in those terms, because when you read the Chinese medical text or the Arabic text, Kanun Fitib, or the medicine developed by Muhammad al-Razi, or the science developed by the Gyuji, which is a Tibetan four tantra
None
text.
of which I've ever heard of.
Yes, well, I'm gonna expand. Yeah, I want to expand. If you read the ancient medical texts that Tibetan doctors have to memorize, the Chinese doctors used to have to memorize the Huangdi Neijing and Shan Han Lung, particularly the Huangdi Neijing first, and that's extensive, but they memorized it.
Right.
Unani physicians study the Kanun Fitib, which is like the eminent text.
But these like ancient scrolls almost?
These are texts written by scholar physicians, written hundreds of years ago, but they were very precise. They were good observers.
Yes, right.
All of these
They might not have understood what was going on, but they observed.
They were better observers in certain ways than we are today in modern medicine and modern science. And in other ways, they didn't have the technology like Dr. Chen has
Yeah.
to pick up the sensors. They discovered thousands of years ago, over 5,000 to 7,000 years ago, the channels of energy. And this is gallbladder, this is liver, this is stomach.
Right.
They knew that 7,000 years ago, but
Mapped
they
it
didn't have
out.
his equipment.
Right.
For him to develop equipment that is so sensitive to pick it up, because I've heard others in medical technology and medical engineering say, or biomedical engineering, we can't detect, we don't know how to pick up the chi energy.
Nor do you know
He did.
those imperceptible little tiny sensor amounts of energy, however it's measured or picked up. What does it mean? How do I turn that into a program? That was the other part, to write a program that can analyze this and associate it with
Just think of that. Think, and I'm saying with all due respect, think of the genius it took to be able to have sensors that can detect the chi, which is nebulous in Western minds,
Right.
and then have program for it on his computer that can measure excess and deficiency and graph it and have artificial intelligence to support it if he wants.
Yeah, and even to explain it to the
And-
patient if they want, right? Yeah.
Exactly. And he explains it to the patient in very simple terms, and he goes about treating you that same day, and within an hour, you feeling better when you leave. And he's not magic, it's science. But to be fair to both Western science and Asian science, to understand Asian science, you have to be good, just like to study Chinese, you have to be, Chinese is a pictogram,
Right.
right?
Totally different
Totally.
representation.
And
not
I
an
told
alphabet.
Dr. Chen, I've been studying Chinese, and I'm still studying Chinese because I get so much more when I read the Chinese of the
I'll bet.
Huangdi Neijing or the Shanhanlong than when I read the English translation. Just like when I read the Quran in Arabic, I get so much more than reading the English translation.
When I was
Or
a
if-
kid in college, I studied Latin for some stupid reason. I'm an Irish Catholic, and I thought Latin was the thing to learn. And it's the basis of all these Western Romance languages. And when you read a story in the original,
Yes.
it's always different.
It's absolutely, I mean,
So much richer.
so much richer. And then you go back to the culture. The Islamic civilizations, like the Chinese civilizations, like the civilizations in India, they had a deep culture of intellectual inquiry and discovery.
Curiosity, yeah.
Curiosity of astronomy, architecture. The Taj Mahal, that's art, but it's science too. It's engineering. How they do it.
Way before when Western Europe was in the Dark Ages and
Just like the pyramids. I mean,
chasing witches. Yeah.
exactly. So we've assumed this false sense of a bubble comfort that because we know Western science, we're medical doctors and we're all that in a bag of chips. If you travel in the world, you see that there are other human beings, including in South America, the Aztecs and Incas, they had medicine too. And in Hawaii, they had the kahunas that I was mentioning. Actually, I was mentioning to the front desk, the ladies at the front desk, I think this morning. They knew when the ships were coming from Europe, that on the day the ships arrived, they were there waiting for them. And they said, how did you know we were coming today, Thursday at this time? They said, oh, the kahunas told us. Because the kahunas could see, just like the African so-called witch doctors. The reason why they called them witch doctors, because they were intuitive, they were psychic.
Yeah.
So now,
or attuned to things that we can't observe or don't see.
just like the Aztec doctors. The Aztec doctors, in order to survive in the jungle, just like me growing up in New York City,
which is a jungle.
yes, in order to survive New York, it's not how big your fists are. Everybody in New York knows how to fight.
Yeah.
Yeah, and we fight to the death, okay?
So I've seen.
But we say, yeah, when you see Al Pacino, Robert De Niro, Denzel Washington, we're all from New York.
Mean Streets. Yo.
Yeah, that's where you get the gangster
Right.
actors, right? But all of us will tell you, what is our biggest weapon? Our intuition. We can read people.
Yes.
And when we go in a restaurant, we go into a store, sometimes we go in, we walk out, and people say, why? Oh, this is mafia. We can't go in there. You can't.
Fighting is when you failed to pick that up.
Yeah,
You get stuck.
you just like animals, they can tell, they know when you're going to get a spanking before you do.
All right, so you have spent your whole life
Yeah.
And you've studied at some prestigious places. What did you do at Harvard? You threw that one out
I didn't.
quickly.
I went to Harvard to do research with Dr. Debajit Biswas. He was his specialty was cellular molecular biology and pharmacology. I worked with him for 2.5 years after undergraduate work. I did some work at Beth Israel Hospital in sickle cell anemia in research with Dr. William McLaurin. And then, so I was going to be a regular medical doctor, but when I said my mother got cancer and she had the chemo and radiation, as I mentioned, I wanted to go to learn naturopathic medicine. And it was a whole long story. But when I got accepted there, my father said, "Hey, you know, your grandfather in the early 1900s was not only a chiropractor but a naturopathic
Come
doctor."
on, get
Seriously,
out of it, really?
So he said because in Harlem, he would take my father to the herb shops to get herbal medicine for his patients. So he treated, and see, for people of African descent, it's no big deal to use natural versus drugs. And I remember my maternal and paternal grandmothers, they didn't like taking drugs. They would rather give me something natural, wintergreen, or let me take this.
My
or
wife is still
sorrel
today,
tea.
yeah.
Sorrel tea is what they call that red tea, the red flower tea. I forget.
Every immigrant that came over,
Yes.
and I know Africans
Hibiscus tea.
didn't come over willingly. I understand the
Yes.
difference between traditional immigration and forced immigration, but
Yes.
you're bringing a culture over from another place with you. And I know my own great-grandmother who was from Poland, you know, she just had all these other home remedies that had been taught to her for years, and everybody kind of laughed. But if you really, some things, you got an upset stomach or a headache or something, or some kind of menstrual pains or something, this stuff worked.
They knew. They knew.
All right. Well, I know we're out of time. We've gone way too long. This has been fascinating. I'd love to continue it because there is a bigger conversation here about who's right, who's wrong, who's better, who's worse. We know, you don't. And rather than approaching that in true scientific fashion, we should be saying what works.
Yes. What
What
can help
works?
people and safely, and how we can educate ourselves how not to get sick.
Yes.
Especially nowadays where we have, you know, the sperm count is lower in men than it was in the 1900s.
Why is everybody looking at me? Okay.
No, it's just that the radiation,
Yes.
you know, Wi-Fi, computers,
Oh, really?
you know,
Okay.
the high rates of suicide, the opioid epidemic,
Yeah.
COVID woke us up in the medical
These
community.
so-called Western diseases of tension and hypertension, and
Exactly.
and a lot of it's many think tied to poor diet.
And insomnia, we work too much.
Yeah.
I mean,
And what do? You go to a doctor with a traditional MD with any of those, what I'll call common Western maladies here: depression, suicide, anxiety, aches, pains, problems. They just kind of look at you like, dude, that's part of the package today. Here, what can I do? Here, take this pill and cover it up. Take an opioid. They were passing out opioids for the last 10 years like they were candy, and now we suddenly realize that wasn't such a good idea.
yeah, if we have to start with us doctors, physicians, the way we're trained and the way they work us like dogs.
Yeah. Oh.
I have medical doctors that are my patients.
Trial by fire here. yeah.
Exactly. Yes. You start in trial by fire, and I have medical doctors tell me that if they don't see 25 to 30 patients each day, they have to go. And these are at major famous medical centers,
Absolutely.
hospitals, clinics.
I've experienced it.
And as we were talking earlier, if the way it works is we're supposed to see a patient every 15 minutes or
And I understand cost control, and I understand trying to keep costs down, but
Certainly.
I also want to don't change the outcome. How well can you perform in 15 minutes? How much can you understand the situation? Maybe AI will help us analyze it and get to the root faster. Isn't that what Dr. Chen's done? Isn't it kind
Yes.
of an AI to figure out how to get to
absolutely.
the problem
He's
faster?
done it. Yes, he's done it.
So shouldn't this be embraced by Western medicine? You did what we thought. That's what we hate about traditional medicine. It's trial and error. It's try this and experimenting and feeling around. He's used a scientific approach. Let's cut to the core. Let's get to the problem, and let's deal with it quickly and inexpensively.
And I want us to remember that as doctors, as for the public, Dr. Chen has developed, he can get a diagnosis enough for him to start treating. So when you see him for an hour, let's say, he has your diagnosis within 10 minutes.
Yeah.
And he's so most of it goes toward treatment. and it's safe treatment. And it's not drugs, it's not injecting you, it's not even putting needles in.
Right.
And then after you finish, he tests you again, and you can see the difference. I think Western doctors they owe it to themselves to see what Dr. Chen does.
I agree.
At Susan Samueli, I would be honored if they could just have him give seminars or lectures there at UC San Diego, Department of Family Medicine, and their integrative medical centers for health, including the 5 centers at UC Davis, UC San Francisco, UCLA, all that have integrative medicine centers. I would ask humbly if they would give Dr. Chen a chance to, including at the symposiums.
Hear him out, see what he's done.
Yes, because it can give a new model in medicine. If AI is going to be the thing, it gives us less time. We can get more precise diagnosis in a short amount of time.
Right.
And we can use more time for treatment for the patient.
All I know is when he says, "Oh," I don't want to mimic him here. I know it's easy to just fall into my bad Chinese accent here or something. But when he says, "Oh, you have problem with this," and all of a sudden I say, "Okay, really?" And he says, "I'll bet it hurts here."
Right.
And you go, "Ow! I didn't know it hurt there."
Yes.
That tells me he's onto something.
He knows, because I share with him, because even when I went to him, I said, my gallbladder channel is off. And in Western thinking, we say, no, your gallbladder's fine. Your x-rays are good.
Yeah, I looked at
and
it.
your lab tests, your liver function tests are fine. And there's no blockage in the gallbladder. In Chinese, this is why you have to study Chinese. They mean the function of what the gallbladder does.
Yes.
Yeah.
And its connection to the rest of the body.
Exactly. And like we were saying, doctors overwork. Most of us work 12-hour days, 7 days a week, because the easy part is caring for patient, because we love caring for people and patients.
Right.
The arduous part is doing all the paperwork. It has its place, but maybe AI can help us with that, and maybe artificial intelligence
Enter
can help
the
us
records.
with it can do the
get
transcribing while we can focus on the patient. And when I was a boy, doctors did home visits, because they were more skillful in their hands, not just their intellect and their heart was there with you. Their hands could detect, oh no, that sweat that you have, you're sick.
That's a whole nother facet.
That's
In
a
fact, the
whole
idea of
facet
healing
that
hands,
doctors,
that's right.
yes, doctors, Dr. Bastier, we asked him, what is the most important tool a doctor can have? He said, your hands.
Wow. Not your eye, not your intellect,
yes,
your hands.
And believe me,
put your hands on a patient.
Exactly. And when I was a student, I said, okay, Johnny, to connect with the patient. But he meant that you connect on as many levels as you can with understanding the human being.
As many sensory inputs.
Yes.
Dr. Chen's giving me another one.
Yes, because when they come to you with a disease, they're away from ease. And disease means away from balance. And his computer system.
Disease is away from ease.
Yes.
Dis meaning not in Latin.
Exactly. Away from ease. Right. So what is Chinese or Asian medicine doing? Bringing the body back into ease. And that was the principal method, technique, therapy, purpose, mission of every doctor, whether it was Ayurvedic, Unani medicine, Greco-Arabic medicine, Islamic medicine, if you want to call it, Tibetan medicine. All of those doctors were considered good if they can restore a patient back to ease.
Well,
balance.
I'll leave it with
Yes.
I'll leave you with my late father's typical was my dad was a rough, tough guy, fought in World War II, fought his way out of the ghettos of Detroit, worked in the factories, eventually rose his way up to being executive of Chrysler, never went to college, not the most educated or the most eloquent man I ever met. He was just a very practical, down-to-earth guy. All right, let's get to the problem. What's the solution? Let's just cut to the chase here. And his whole philosophy was everything in balance.
That's right. That is a secret to health and nature. Nature loves balance. It does not like imbalance.
Exactly. Well, we're way out of balance in time here, but it was worth the time. Thank you for coming. How do they reach you, Dr. Abdullah, if they want more about the work that you do?
I'm at OC Whole Family Wellness. It's a clinic in Laguna Hills in Seattle, and I'm also at Seattle Healing Arts. I do telemedicine, but no, I'm here. I live here.
Okay.
And I moved here about a year ago. But I'm at the OC. It's called Orange County Whole Family Wellness Center. in Laguna Hills.
And there they'll discover this whole naturalistic and holistic approach that you're taking to patient care.
Correct. And since I'm a new doc there's about 7 doctors there, naturopaths and osteopathic doctors there, acupuncturists. I just have Thursdays and Friday mornings, and as I develop more patients, they will expand my capacity to see more patients.
And if somebody wants to hear about, they got a chronic condition, Dr. Chen, they've been everywhere in town and nobody can tell them what to do, if they want to get their free chi analysis to find out what your sensors tell you, and then to try acupressure, not acupuncture, where you're not puncturing the body, but acupressure, a deep tissue massage to find those knots and unblock them. How do they find you, Dr. Chen?
Yeah, welcome to the Tomii Healing System. We found the blockage and imbalance within a minute. This blockage and imbalance is the underlying cause of chronic condition.
And you both have the underlying belief.
We are in the Anaheim Hill.
Anaheim, yeah.
And Tomii is Tomii, like
Tomii is Tomii, 714-998-0128.
Well, I hope you'll both come back and talk more, because I think more and more of my generation, we're not trusting like in doctors like we used to. We don't think that's the end all and be all. We believe there's a power and a purpose for Western medicine, but we also think there's something beyond that. Particularly, there's got to be something more than a pill and a procedure, particularly for chronic conditions. And we're willing to look at traditional methods.
We need every doctor in conventional medical doctors, every doctor, every science, every research. We can work together. We can understand each other. Some things we'll never understand because, like I said, Chinese medicine, Tibetan medicine, Ayurvedic medicine, naturopathic, homeopathy. It's for a Western mind, it's hard to comprehend, but you'll see its efficacy clinically. And for us as clinicians, we're not in the blah, blah, blah talk. We want to see what's worked. And I've had patients with very severe mental, emotional conditions that homeopathic medicine turned it around.
There you go.
That made me a believer because, as I said, I was doing research in Harvard Medical Center. I never thought that you can have these little white pellets that you put under the tongue that's energetic, that can shift the body.
Yeah, that's
just
a whole nother discussion.
It's a whole different discussion.
Well, I welcome this discussion. I think many of my generation do. We're looking for, we don't want to age like our parents do. My mother was so addicted to 20 medications and so zonked up by the end of her life. And I thought, what a sad way to go. So we're all trying to eat better, exercise better, and certainly stay in close contact with the medical breakthroughs that are needed, but don't dismiss the age-old wisdom that too often has been forgotten or put aside here. Thank you for joining us here today on the Tomii Healing System.
Thank you for
so
inviting
much.
us.
All right.
Thank you for inviting us.
Thank you.
Yes, thank you so much.
All right, let's play the out music here. There we go. That's it. If you want to hear more about the alternative approaches and paths, tune in to the next Tomii Healing Show right here at University of California, Irvine's Beale Applied Innovation Center.